Hi there, is it James Bryson?
Yes, yeah.
Excellent. Nice to meet you.
Nice to meet you.
All right. So, how can I help you today? Yeah, so I've been finding it quite hard to breathe over the last couple of months. And I've sort of been having this cough, especially at night time, quite a dry cough.
All right, okay. Can you tell me a little bit more about that?
Yeah, so I've got this sort of general tightness around my chest, like especially when I go out and, you know, I'm playing sport, for example, and I feel a bit wheezy as well.
Okay, so wheezy and tight-chested. Anything else associated with that?
Not that I can think of, no.
Okay, sure. And have you had any pain in your chest?
No.
No, okay. And have you noticed any swelling or pain in your calves?
No.
No, okay. And anyone in your family had any history of any clots or things like that in the legs?
No.
No, okay. And any long distance travel recently?
No.
No, good, okay. And have you noticed any weight loss?
No, I wish.
Okay, fine. Any loss of appetite?
No.
No, okay. And do you smoke at all?
I used to. It was like 5 a day, but with my friends, but I've stopped now, so.
Good, I'm glad to hear that. That's really good news. Do you get any burning sensation in your chest?
No.
No, and do you get any kind of acid in the back of your throat at any point?
No.
No. Okay, good. All right. Just gonna ask you a few more questions. Do you drink much alcohol at all?
I have like a glass of wine a week.
And do you have any other medical conditions?
I guess I have like eczema on my hands, but I just use cream for that, so.
Okay. And do you have any medications that you take regularly?
Oh, I do take antihistamines for my hay fever as well.
Okay. How long have you had the hay fever for?
Just since I was a kid.
Okay. And do you get it every year?
Yeah,
Yeah.
around the same time.
Okay.
So.
And does anyone else in your family have any symptoms about the chest that you're describing?
No.
No. And does anyone in your family have any eczema or any hay fever?
No, not that I can.
Not that you know of. Okay, that's fine.
And just need to ask everyone this, any recreational drug use at all?
No.
No, okay. So you've described a few symptoms to me. Do you have any ideas what this might be, or do you have any specific concerns that are worrying you?
So my friend mentioned that it could be asthma, and I guess I really want to get out and start playing football again like I used to. Hopefully this can get sorted out soon.
Yeah, sure. Okay. Well, hopefully we'll get to the bottom of this. What I'd like to do is just examine you, if that's okay. So if I can get you to go onto the couch, and I'll just get myself ready. Is that okay?
Yeah.
Excellent.
Cool. Okay, so just have a quick look at you from the end of the bed. Fine. Now, just have a quick look at your hands. Feel your pulse. And that's fine. Just have a quick look at your face. That's fine. Just gonna have the feel of your neck. Great. You want to take your top off for me?
Yeah, sure.
So looking at the chest now. That's fine. Take a deep breath in and out for me. Okay, and deep breath in again. And out. And breathe in and out. Just tapping on your chest. Right, so I'm going to have a quick listen. Every time I put my stethoscope on, just take a deep breath in and out for me.
Okay.
That's great. Have a quick look at your legs now. If you bring the other one up, that'd be great. Thanks. Fine. You okay just to swing your legs over the other end of the bed, and
sure.
I'll examine the back of your chest now. So again, just having a quick look. And a deep breath in and out for me. Okay, and breathe back in again. Excellent. Okay, just have a quick tap again. fine. And again, just going to have a quick listen to your lungs, so just breathe in and out when I put my stethoscope on. Excellent. Okay, and now I'm just going to have a quick feel of the nose and your neck. Okay. And that's fine. Good, excellent. So you can put your clothes back on, and I'll just get you back by the desk and I'll have a quick look at the things there. Okay?
Thank you.
Okay. So what you described to me and what I found on examination does suggest that it's likely to be asthma. Do you know anything about asthma at all?
No, not really.
Okay. Do you want me to explain what it is?
Yeah, sure, please.
Sure. Okay. So asthma is a genetic condition, but it has environmental factors that also influence it. So things like dust mites, pollen, and also sport, which is what you're describing to me. It's genetic, so it can be inherited, and the fact you've got eczema and hay fever also suggests that asthma is quite likely because they all go together. Now the good news is that asthma can be well controlled with medications, so just with the use of inhalers to start with. But the thing that we need to do first of all is make sure we've got the diagnosis correct, that it is asthma. And the way that we do that is by using this thing, which is called a peak flow meter. Have you ever seen these before?
No, I haven't.
No. Okay. So what I'm going to do is I'm just going to describe and show you how we use it first of all, and then I'll get you to tell me back how to do it, and then we'll get your first readings today. Is that okay?
Yeah, that's all right.
So this is the peak flow, and what we want to do is put a fresh mouthpiece on each time. We need to make sure that the dial is down at 0, and then what we want to do is either in a sitting position or standing up, whichever one's easiest for you. We want to hold it at 90 degrees to your mouth. Okay. Then what we want to do is get a good tight seal around the end of the mouthpiece, and then blow as fast and as hard as you can. All right. So I'll just show you how to do it. So sitting up straight. Okay. And then the reading you get is shown on that red dial. So I've got about 620 on that. All right.
Okay.
Are you all right to just show me how to do it, just to make sure you've got it right?
Okay. I need to check that it's down to 0. Put the mouthpiece on that end, like that. Hold it at 0 degrees. Take a deep breath in, and then I'll form a seal and blow in.
Yeah, and it needs to be as fast and as hard as you can. Okay, so got 250. Okay, and if you want to try that 2 more times.
Okay.
Okay, and again as hard and as fast as you can. Excellent. So we got 350. Okay, well done. And if you try that 1 more time. And again, it's about 330. Okay, good. Well done. So then what we do is we use a chart like this just to see where we're at. So do you know how tall you are?
175 centimetres, I think.
Yeah. Okay, perfect. So 175 centimetres, and you're 24. Is that right?
Yes.
Yeah. Okay. So you're 24 years of age, at 175 centimetres. So what we would be expecting is roughly about 620. Okay. So we're a little bit off of that, which again fits with the diagnosis of asthma.
So what we're going to do is give you this thing, which is a peak flow diary, to keep a reading of it. It's got some information on asthma in there as well. And what I want you to do is to take the readings in the morning and in the afternoon, okay, and just record the best of your 3 values.
Yes.
And what I'm going to do is prescribe you 2 inhalers, a brown one and a blue one, okay? I want you to take the brown inhaler first thing in the morning every day, and take the blue inhaler if you're feeling a bit tight-chested, so when you're playing sport, if you're just feeling tight-chested in general, and then record those values. Is that all right?
That's okay.
So I'll print out the prescription. It'll be ready for you at the desk when you go out. And what I'll also do is I'll book you in to see the specialist nurse tomorrow, and she'll go through inhaler techniques with you then.
Okay.
All right? and I'll book you in to see me in 2 weeks' time. If you could fill that diary out and just tell me how you're feeling, and then we'll see what those values are doing with those inhalers. Does that sound okay?
That sounds alright.
Excellent. So do you have any questions for me at all?
No, I don't. Thank you.
No? Alright. Well, I'll see you in 2 weeks' time then.
Thank you.
Alright.
Bye.
Nice to meet you. Okay.